Evening, class. We're down to the last two modules of our class for this semester. And typically, what I do with these last two modules is try to bring something in that I'm going to say new and exciting, but maybe some new concepts that students or individuals in the industry reach out to me about. And I think we're going to do for this session, this module, we're going to do artificial intelligence. Doesn't matter whether you listen to Fox or CNN or NBC or CBS. It doesn't matter which of the talking heads you're listening to. Everybody's talking about artificial intelligence. And it is a very valid topic in healthcare, artificial intelligence, because there could be significant opportunities to improve efficiency, quality, just overall healthcare through the use of artificial intelligence. So that's what we're going to talk about this module. The next module we'll kind of wind the class up with. We're going to talk about some value-based contracting. So let's jump in. And again, we're going to talk about artificial intelligence. And I've gone out to the internet, and I think I loaded a artificial intelligence document for you out on Canvas, and it's specific to payment integrity. I think it's specific to fraud, waste, and abuse. So give you an idea of, and I think that was more from a vendor perspective or a third-party consultant. So that's how they're using artificial intelligence to spin the value of the consulting services that they are selling, in this case to a health plan, but it could be the same flip on the other side of that financial coin. You've got consultants out there trying to sell artificial intelligence services to the provider community. So it doesn't really matter which side of that coin you're on, either on the payer side or the provider side. You're going to have some opportunities to maybe become involved in this, at least in theory, this artificial intelligence revolution that's going to sweep through healthcare and turn it on its head, and just as it works through the system, it's going to generate a more cost-effective, more highly efficient, a higher quality type of product in the form of healthcare goods and services, either on that you're consuming on and going up on the payer side, or that you're producing on the provider side. And so one of the definitions that I found out on the internet for artificial intelligence, it's a term used to describe the use of machine learning algorithms and software or artificial intelligence to copy human cognition in the analysis, presentation, and understanding of complex medical and healthcare data, or to exceed, I'm surprised it had that terminology in there, but to exceed human capabilities by providing new ways to diagnose, treat, or prevent disease. And when it talks about artificial intelligence or machine learning, and to me, machine learning is nothing more than structured linear regression. So, but artificial intelligence, or whether you're using machine learning, you are actually the software or the programmers or the system, whatever nomenclature you want to use, is trying to develop the ability to learn from massive, and when I say massive, I'm talking about huge levels of data. The more data you have, in theory, the more accurate and the more faith you can have in artificial intelligence. And the question that everybody, at least those that I've talked to in the healthcare space, the question they have is, if you're on the provider side, they're concerned, is it going to replace medical staff, especially some of the front end medical staff, and to some extent physicians. If you're talking about artificial intelligence on the payer side, the concern is, what's it going to do to actuarial teams, to analytical teams? Again, where we're talking about healthcare informatics or medical informatics or biomedical informatics. What's it going to do to the analytical side of that sector? And hopefully, as we walk through this, we'll get into some of that as we move forward. One of the things that you'll hear early on artificial intelligence, as it arrives at a conclusion based solely on the input of data. There's not a lot of, as it says, human cognition built into artificial intelligence. It's just learning from data, massive amounts of data. It analyzes relationships between clinical data and patient outcomes. So it's trying to build those relationships between the clinical data that's feeding into it and the patient outcomes or the consumer outcomes of those treatment protocols, trying to build that relationship so that at some point, in theory, artificial intelligence can assist providers, maybe replace providers in some instances, but assist providers in, based on the clinical diagnoses, developing and implementing a treatment protocol that's going to drive a more positive level of outcome and a higher patient level of satisfaction for the end user or the patient. When you think about artificial intelligence, one of the first things that come to mind, at least for me, is on the provider side, is the doctor's office. I go to a physician here in Atlanta. He's not a doctor. He's a DO. Didn't go to medical school. He went to DO school. The guy's pretty sharp. But sometimes I go in to talk to him, and I'm not sure he's on his game. It's really scary when a Yahoo like myself, who is, I'm a doctor, but it's a PhD in finance and economics, and I've utilized that information in the healthcare space, and I've learned some level of healthcare information along the way. And when somebody like me goes into the doctor's office and I seem like I know more than the individual treating me, it gets a little scary. And I'm not one of those skeptics that thinks that artificial intelligence won't help the diagnosis and treatment of medical issues or clinical issues in the doctor's office. I think there's a tremendous amount of opportunity there, especially if you're talking about, emergency room and urgent care. Last time I went into an urgent care visit, I've been twice since I've been here in Atlanta. First time, just a complete waste of time. The second time I went in, I'd done some research on the internet. I knew what I needed, and I just needed somebody to write the prescription. I went in, told her my diagnosis, told her my symptoms, and the individual, says, "Well, what do you think? What do you think you need?" And I said, "Well, here's exactly. I know what I need," and I told her exactly what the prescription needed to be, and she said, "Oh, okay, that makes sense." She, sent the script over to Costco, went over, picked up my medication, and went on my way. So it gets really disconcerting when you go in to see a provider, and again, urgent care, emergency room, doctor's office, primary care specialty, hospital, it doesn't matter. When you go in to see a provider and you come out of there thinking that you know more, you as a lay person, you, me, anybody walks in, when you come out of there thinking you know more than they do, to me, it raises some red flags. You've also got the hospital. Think about artificial intelligence and think about that there's two ways to end up in a hospital. You've got elective type procedures, or you can come in through urgent care or the emergency room. So, and elective type, for the most part, your provider probably knows what the issues are before you're admitted. Not in every case, but a lot of cases. If you're coming in through the emergency room, though, or the urgent care side, think of all of the missteps that can occur as they're trying to treat your diagnosis. They're trying to diagnose what's wrong with you, and then the secondary piece of it is how comfortable do you feel with their treatment protocol. So again, hospitals, emergency rooms, urgent care, you wrap kind of all of those together, and significant opportunities for artificial intelligence there. As I talked earlier, let's talk about health plans. On the analytical side, you've got financial analysts, you've got medical informatics, clinical informatics, you've got actuarial. But think of all of the analytical processes that are driving the decisions of that health plan. And if you have artificial intelligence that can code more efficiently, and the code that they write is more accurate and drives a higher level of positive or higher probability of positive decisions for the senior management team in that health plan, just think about the opportunities that artificial intelligence brings on the payer side of the house. And also on the payer side of the house, you've got nurse hotlines. And it even says on the back of most of your cards, if you want to talk to on the nurse hotline, call this number. And you call that number, and if you had a nurse on that other end of that line and had access to artificial intelligence, and she could start coding in what your symptoms are, and artificial intelligence is telling you what questions to ask, and she's asking the questions, getting responses, she's keying it in. And at the end of the day, you have a fairly high probability of being diagnosed accurately, having a treatment plan put in place, and maybe you don't even have to go in to see a provider face to face. You've got healthcare associations, AMA, American Medical Association, you've got American Hospital Association, are looking at artificial intelligence to help them develop evidence-based medicine and treatment protocols that they can roll out to the provider communities. You got medical schools. Are the medical schools embracing artificial intelligence? Are they using it to train this new set of residents and interns and medical students that are going to roll out and be the healthcare providers of tomorrow? Research institutions and grants. Think of all of the not only medical school, but schools that have research programs geared toward the medical community. There's tremendous, again, a lot of opportunities there to involve artificial intelligence. Some of the things that you're going to have to control as you roll out artificial intelligence, you've got bias. You've got, and again, because artificial intelligence or machine learning are learning from the data, huge amounts of data. They're trying to take data and turn it into treatment protocols, taking clinical data, taking patient information, demographics especially, trying to turn it into treatment protocols. Think about bias. Age, sex bias, race bias, or a lot of bias involved in the data. And how does artificial intelligence manage the bias that's already embedded in the data? We talked about earlier kind of the principal agent issue when you go to see your physician. You've got asymmetric information when you go to see your physician, and as a patient, are you fully disclosing to the provider or to your provider, what's really impacting the way you feel? Or you forget about the time, you have 5 or 6 drinks every night, you smoke a pack of cigarettes a day. You neglect to tell that to the provider, and it's going to bias not only the clinical diagnosis, but the outcome. And then when we go back to the principal agent issue, you've also got this SID, this supplier-induced demand. And so you go to see a physician that, has set up his or her own laboratory unit or his own radiology unit in their office. And, they all of a sudden they're diagnosing you, putting together treatment protocols, and they say, oh, by the way, you need to go get this lab work done. Or, oh, by the way, that I'm concerned about your ankle. Maybe you need an X-ray. So they need to generate revenue from the laboratory services or the radiology services. But unfortunately, what it does to artificial intelligence, machine learning, it's embedding those biases from SID or that supplier-induced demand. It's embedding those biases into the data. And if we're not careful, those biases embedded in the data will translate into the correlation that artificial intelligence is trying to make between the clinical information and the treatment protocols and the outcomes. AI can be applied especially to diagnostic services, lab and radiology. Those seem to be areas that are going to have a significant opportunity to benefit from artificial intelligence. Treatment protocol development, and it doesn't matter whether it's AMA, AHA, medical groups, hospitals working independently, public health with their group of individuals that are doing research. That's, developing these treatment protocols to more effectively diagnose and more effectively develop these treatment protocols that are higher quality and generate greater outcomes. You've got drug development. Think of all these pharmaceutical companies that can use artificial intelligence when it comes to drug development. You got personalized medicine. You can use artificial intelligence to help personalize your medical or your medical types of opportunities. Because at the end of the day, remember, as an individual, we're trying to manage our health status. We're trying to minimize the deterioration of our health status over time. So think of all of the opportunities for artificial intelligence when it comes to personalized medicine. Patient monitoring and care, artificial intelligence through these mobile devices. You've got all the watches and the mechanisms you can wear on your wrist that constantly sending information to your doctor's office. It helps determine your treatment protocols. Think about the blood glucose monitors that you can apply them to your skin and rub your cell phone across it. You see the advertisements on TV. Huge opportunities in artificial intelligence. You've got, again, cost control, overutilization, and waste can be mitigated through the use of artificial intelligence. The last numbers I saw from one of the government agencies for 2022, I guess, was that 25% of healthcare expenditures are considered waste. Overutilization, cost control out of hand, providers trying to bill for services that may not be needed, or repetitive type services, because most provider contracts, and we'll get into it when we go to the value-based piece on the next module, but most providers contracts are still based on a volume basis. It's revenue of the providers is determined by the price of the service and the quantity of the services. So volume, the more quantity you have at a given price, the more revenue you have. AI uses extensive amounts of input data to train and create logic. Again, huge amounts of data to train and create the logic that drives these medical protocols. AI logic differs from humans in algorithms are literal. So basically, once you set a goal in the AI process and start running the data through to drive to that goal, the algorithm learns from input data and can only understand what it's been trained to do. There's not much flexibility in it, no subjectivity, and could be a downside. So I think at the end of the day, you're going to have some combination of artificial intelligence. It's learning from the data that can learn from the data more efficiently maybe than humans can, but there needs to be some level of human cognitive effort involved in the process in order to generate these treatment protocols. Some deep learning algorithms are black boxes. They can predict with extreme precision, but offer little to no comprehensive explanation or analysis. Running data in, runs in the black box, spits out the results over here. Results are extremely accurate, high level of precision, but you're not going to get a lot of explanation. You're not going to get a lot of comprehensive analytical work out of AI. And that's where you're going to have that human cognitive input. We'll talk about it again. Another article I found out on the internet talking about the issues with AI in healthcare. It's relatively new. And because it's relatively new, it's resisted by healthcare leaders. And so it could be slow and erratic adoption. You've got AMA, you've got AHA. Remember, AMA, AHA, Actuarial Society, they are trying to control the supply, doctors, hospitals, actuaries, to ensure that a level of revenue is out there for those individuals that are trained in those types of specialties. So AI, if they're talking about changing or maybe impacting the supply of physicians or impacting the supply of actuaries, there may be some resistance to incorporating AI into the healthcare arena or healthcare marketplace. There also could be some ethical concerns. You've got data privacy, you've got HIPAA issues, you've got automation of jobs. But again, a lot of individuals are in the healthcare space, especially, are concerned with loss of jobs, loss of human type jobs that, what are we going to do to reallocate those human resources? And again, there is a potential, and we talked about it a few minutes ago, of just this representation bias. Goes back to the principal agent. It goes back to, ethnicity, age, sex bias, SID, inaccurate information that's built into this data, and the data is actually driving AI, and as it drives AI, the formulation of that logic or that algorithms is going to generate maybe inefficient treatment protocols. And one of the things that's feeding this AI movement is just think about the significant increases in computer power, over the last 5 years. Think of the electronic health record and electronic medical record. More and more hospitals and physicians are on electronic health records and electronic medical records. And then you've got language, natural language processing, which it's going to go a long way in taking, to me, it's somewhat humorous, but it's natural language processing is going to be a huge boom to understanding and to extracting information out of a medical record. Have you ever tried to read a medical chart or a medical record? Physicians, depending on what area of the country they're in, depending on what their specialty is, depending on whether they went to medical school, they use somewhat different nomenclature. They have their own level of shorthand. And the nurses that work for me in Buffalo constantly frustrated because there wasn't a lot of consistency in the nomenclature that physicians used when they were writing their, in the medical chart. And even though electronic health records, electronic medical records have gone a long way to providing some consistency, there's still just a lot of inconsistency in the structure of language that healthcare providers use. And that's one thing that this natural language processing is helping. We bought some natural language processing in the Buffalo office. And once the nurses, nurses a little slow, they were a little slow to accept it and to embrace it, and which is natural for a lot just human nature when you bring in new products. But we brought this new product in, and it would take a 1,500-page medical record and spin through that thing using this natural language processing. And you basically built edits in your natural language processing. And again, you trained it. You told it, here's the goal. I want you to find the last time, the patient had an A1C test for the, diabetes, or when's the last time they had a colonoscopy, or, what was the diagnosis that, drove the admission. And you would tell the system, AI, and it would spin through it again. No flexibility. It wasn't looking for anything else, just what you were telling it to. But the improvement in efficiency that these nurses realized was really exceptional. We paid, we were paying for the service. You pretty much had it paid for on an annual basis within the first month, just because of the efficiency increases. I'm going to talk just a few minutes. Let me see what I've got here. I'm going to talk just a few minutes. I think what I'm going to do is, rather than having multiple videos, I'm just going to roll all of this into one video. We have the first thing we're going to talk about clinical applications, then we're going to talk about some system applications. Clinical applications, you can just kind of think through this as we go through it, but one of the clinical applications that seems to be on the forefront is cardiovascular, because they're trying to predict patient mortality, medication effects, adverse events associated with it, and the data for cardiovascular work seems to provide a fairly decent base to incorporate AI into the types of research that they're doing for cardiovascular. It's going to be extremely important if it can help them with early detection of events using technology and wearable devices. Social determinants of health drive the production or the prediction capability. So a lot of the preventive type services under cardiovascular stand the opportunity to be really receptive to artificial intelligence. You've got gastroenterology, things like colonoscopies, detection of abnormal tissue, endoscopic procedures, to help you identify procedures and diseases and determine severity and visualize blind spots. Now they've gone from colonoscopies. Now you've got this take-home outfit. I think it's Cologuard. You see it advertised on TV that you do the work at home and send it in, and it's using fecal material, and you send it in, and it's somebody reads it in a lab somewhere. And now rather than colonoscopies, and I can't remember the terminology they use, but basically what it is, it's I can't remember the dimensions, but it's a fairly good sized capsule. Looks like probably a little bigger than like a calcium pill that you might take as a vitamin. And what you do, it's got some receptors in it. It's got its own little lighted cell in it, and you swallow it. And I think the last time I read it, it takes 24 hours from the time you swallow it, maybe until it goes all the way through, your digestive system, and then it comes out the other end. But and it's processing information, and it's taking pictures of your stomach and your intestines and your colon, and it's trying to revolutionize the way we do colonoscopies. So artificial intelligence in gastroenterology is a huge opportunity. Neurology, diagnosis and prognosis of Alzheimer's disease. I mean, Alzheimer's disease is a significant concern with a lot of individuals in the United States. I mean, just watch the advertisements on television. And so artificial intelligence seems to have a significant opportunity when it comes to neurological type issues, especially if you can diagnose for early onset of Alzheimer's using some type of imaging process. Kind of similar to gastroenterology and neurology, you've got oncology, cancer diagnosis, risk stratifications, molecular characterization of tumors. You've got cancer drug developments, a lot of different opportunities. And again, most of these we're talking about the provider side. Now, most of these on the provider side, and especially on cancer, helps through artificial intelligence using just these huge amounts of data can help determine the most cost-effective and highest quality treatment protocols. We've talked about pathology, but You've got digital pathology, breast cancer, hepatitis B, gastric cancer, colorectal cancer. All of this is being driven, the opportunities in AI, especially when it comes to pathology. Can AI predict genetic mutations, prognosticate disease outcomes? Then it gets in a few minutes, a few items. It talks about histological findings at levels beyond the human eye. I mean, you think about all of these types of advances in medicine that could be driven by artificial intelligence. We've talked about primary care to a certain extent because of the decision making, the predictive modeling, the business analytics. And again, the information on the internet, we're talking about the principal agent issue and asymmetric information and supplier induced demand, and just looking at the opportunities in the primary care arena for AI to drive an environment that is cost effective, higher quality, greater probability of positive outcomes. You've got radiology. Think about radiology and laboratory. You can kind of hook those two together because they're both in the diagnostic realm. Detect and diagnose diseases via CTs and MRIs. Settings where human expertise demand exceeds supply. And if you stop and think about it, I go back to functioning healthcare in Southern California. If you're talking about the high desert in Southern California, where you're up at like Edwards Air Force Base, you're 29 Palms, you're Barstow, you're Fort Irwin, up in the high desert, there were not enough physicians, especially radiologists and radiology type services, to satisfy the demand. Be a great opportunity for artificial intelligence. Data too complex for human interpretation, and that is a real opportunity, not only radiology, but to me for pathology. Non-interpretive benefits. You can reduce the noise that you see in these radiology type services. High quality images. It would enhance the CT and the MRIs. Automatically assessing image quality. Again, great opportunities. And again, most of these opportunities that I've just gone through, if you notice, they're on the provider side of things. If you look at system applications, we're talking about disease diagnosis. We're talking about, vector machines, neural networks, decision trees. Training is the goal. Classifications agree with the outcome. So that's what you're trying to do. Through the system application, you're trying to train AI using data, train it so that it ties the correlation between clinical data and the outcomes, the most desirable outcomes or treatment protocols. You're talking about artificial intelligence as it manipulates the data that you find in the electronic health records to aid the provider, whether it's a physician or the hospital, in diagnosing the ailment that you have presented to the provider with. Helps identify systems. It helps ask key questions. So if it's in a decision tree and it starts down through the decision tree, the more information you get, depending on which way it goes on that decision tree, it's generating key questions to help it determine, do I take this route or do I take this route? It's developing the correlation of information, clinical information, and treatment outcomes with others in the sample. So you feed the sample in, and using that sample of data, it's trying to determine those correlations. Telemedicine. And again, telemedicine is kind of a broad topic, but telemedicine It monitors, artificial intelligence can be highly effective in monitoring information via sensors, monitors continuously, it identifies changes, it predicts based on data outside the norms. And if you think about these wristbands, these mechanisms go around your wrist, maybe it's a mechanism, that you got taped to your chest or taped to your arm. Artificial intelligence doesn't sleep, doesn't have to stop for breaks. There's no bio breaks. They don't stop for lunch. They don't, artificial intelligence doesn't have to stop and go out for a smoke at a break. It's running 24/7. It's monitoring this information 24/7, and it can readily pick up on these changes that could significantly affect the health status of the patient that it's monitoring. Think about chatbot therapy. And I can get on right now, and I can get in the Piedmont system here in Atlanta, and I can be typing into the chat box, and something's responding to me. I don't know whether it's a human on the other end. It'll say, chat box say, "Hello, my name is Lucille," and I'll type something in, and it'll type a response back, just like the chat box. If you're this time of year, everybody's working on their taxis. Just AI, whether you're using TurboTax or whoever you're using, they've got that chat capability. You don't know whether it's a live person on the other end of the line or it's some kind of a robotic response he's coming back. But think about the chat box therapy. Chat box therapy, like artificial intelligence, it has learned from the data. It is taking clinical data and clinical information and the answers to the questions it's asking, and it's driving responses. It's as good as human interface in most cases, and again, works 24/7. Doesn't need to sleep, doesn't need meals, doesn't need breaks, nothing. It's just 24/7. It keeps plugging along. You've got environment and personal sensors for elderly populations. Once you get into an elderly population, if you're not, and I don't, any of the students that I have, I don't think hit the elderly population yet. But if traditional Medicare, you go to a Medicare Advantage plan, you've got a lot of opportunities for this, virtual type of collection of data. Again, they've got sensors you take to your chest, on your arm, the wristbands you wear, just a lot of information. And they not only do they take this clinical information and drive outcomes, but now they can map out your home layout, map out your personal activities. Maybe some issues with privacy there, but again, trying to help you change as a patient, helping you to optimize your health status by maybe changing the processes you go through at home. Maybe you live in a 2-story house, and maybe you're up and down the stairs too many times or something. Maybe you don't go outside and get exercise and get the fresh air and the sunshine you need. And that's what telemedicine through these virtual applications have the capability of doing. You've got the electronic health record. And it's something, north of 80% of all physicians' offices now are incorporating this electronic health record. They're deep into e-health, transferring information, and digital health, collecting information and feeding it back into the electronic health record. It interprets information to assist the physician or to assist the individual at the hospital. And again, it goes back to the natural language processing is driving consistency. One of the really keys to the electronic health record and these mobile devices, digital health is, especially with the natural language processing, it comes in and the medical record is it's reading this medical record or reading this electronic health record. And one doctor writes, Mr. Smith had a heart attack, and the next doctor will write, Mr. Smith had a myocardial infarction. Same thing, different nomenclature, but this natural language processing picks up on this, has the capability of picking up on this and driving information. Um, it's also used in managing redundant information. These electronic health records, they have a function in there called, cloning. You come into the doctor's office and a lot of the information that you present with every time, it's the same. So it just clones it. It clones it and there's not a lot of human interaction with it. It remembers to include all of the relevant facts. Diabetes, high blood pressure. I mean, if you've been coming to see this physician, let's say once a quarter for the last 2 years, so that's 8 visits, and you've always had a diagnosis of diabetes in your electronic health record, and on the 9th visit you come in and the physician's just not on it, not on his or her game or not paying attention, and they don't get that information imputed into the electronic health record, the chances are you haven't been cured of diabetes. It's just they forgot to include it. And artificial intelligence, electronic health records, in conjunction of working, can remember to include those relevant facts. Artificial intelligence can be programmed to make electronic health record audits or edits to the information. Can predict the risk of disease based on patient history. Predictive modeling can improve individual treatment responses. You have to remember that as I've gone through this piece of it up to this point, electronic health records, especially artificial intelligence, isn't going to be the answer. It's not going to be the greatest thing since sliced bread. It's going to really improve the efficiency of providing healthcare goods and services. But the results of artificial intelligence is only going to be as good as the quality of the information it's based on. Remember, it's taking huge amounts of data, feeding it in, running through it, and it's learning from this data. It's correlating the clinical information and driving treatment protocols. But again, it's all based on the information it's feeding. And we talked earlier about the biases that could be in the information. We're going to wind this piece up on artificial intelligence. We're going to just talk about the health plans and the healthcare industry. With mergers and national players, you're getting larger and larger data sets. It's driving, especially on the payer side of that financial coin, and it doesn't matter whether you're a health plan or you're one of the government agencies that's the buyer of healthcare goods and services. It's going to improve the efficiency of coding and programming. At least in theory, it's going to improve the efficiency. I hope one of the greatest attributes of artificial intelligence is to reduce false positives. If we as a healthcare analytical team can reduce the false positives, it's going to make the information that we provide to other functional areas within a health plan that much more efficient. It's going to maximize the efficiency of the resources that are using the information that we're generating. You wanted artificial intelligence to help predict episodes of care. You wanted to use artificial intelligence to help predict, population health cohorts. Definitely you wanted on the health plan side of the house where you're talking about risk management, definitely wanted, again, on that risk management side, medical management, case management. You want artificial intelligence to help the health plan develop those medical management policies, develop that case management side of the house so that once you have been identified as either a high-risk patient or once you've been identified as a patient that has significant medical issues, then you can be turned over to medical management, be turned over to case management, and artificial intelligence will be using this massive amount of clinical information to help drive protocols that the health plan will use to help treat your particular health issues that you're presenting with. Also, payment integrity, and payment integrity. Again, the group I managed in Buffalo or directed that team, and one of the issues we had in payment integrity were just the large number of false positives, large number of times we were spinning our wheels trying to identify opportunities to improve the adjudication process, and we were having to fight through a lot of these false positives. One of the other areas that, at least on the health plan side, it's going to focus on clinical decision support decisions. More data drives more accurate, robust responses and solutions. And I think it's not just more data, it's more accurate, relevant data is going to drive a higher level of accurate, robust responses and solutions. Digital consulting applications. Think of all of these applications that feeding information, and the health plan will come out to your home, and they'll help you, with this wristband that you're going to wear, and it's going to continually feed information both to your doctor's office, but it's going to be feeding and maybe back to the health plan too. And the health plan is going to be using that information in conjunction with the doctor's office to try to drive or try to develop a clinical protocol or an evidence-based medicine type of strategy that's going to optimize your health status. At the end of the day, both sides of that financial coin, both the payer and the provider, should be focused on helping you, the patient, optimize your health status. It's going to at least provide, hopefully, artificial intelligence will help provide transparency between patient focus versus provider focus versus the payer or the health plan focus. And then you get into when you're talking about artificial intelligence, there's a lot of information out there, and if you want to get out and read it, you can. Talking about using artificial intelligence to provide access to healthcare goods and services in developing nations, working with the World Health Organization to roll this out. You have physicians that go with what they call it, Doctors Without Borders. And artificial intelligence has an opportunity to significantly improve the applications that are out there and roll these out to underserved, undersupplied, high demand, high risk populations in developing countries. And the last thing, again, wanted to touch on, there are some ethical concerns with artificial intelligence. You've got data collection and all of the biases that we've talked about that are inherent in the data that's collected. You've got the automation issue. What's automation going to do? Is it going to just significantly reduce the demand for analytical services from a human perspective, or is it just going to create additional jobs and create jobs that you're going to have to, as an analyst, I guess, develop a new skill level for? And then you've got the bias that's just built into artificial intelligence just in general. And artificial intelligence is going to prioritize profits. The companies developing artificial intelligence are driven by profits. It's a profit motive. We've talked about it on numerous occasions. Companies are in business to drive profits. And unfortunately, is there a bias against minorities being built into this artificial intelligence? Google's already had, can't remember what Google's bias was. 2-3 weeks ago, they caught Google with their artificial intelligence. I think it was Google with artificial intelligence talking about the bias. And it may have been bias against white males or something weird. Anyway, You've got those biases that, are just, they're going to be inherent. And how does artificial intelligence and the companies managing the artificial intelligence, how are they going to mitigate those biases that are impacting it? Like to thank everybody for joining. And when we get back together, we're going to talk about, on the next module, we're going to talk about value-based healthcare. Talk to you soon.